And clearly my first mistake of this voting session is to click the X in the box that was the meeting as opposed to the X in the box that said you are now live. So that's probably going to set the tone of this voting session. I apologize for leaving by accident. Let's start the voting session of HGO voting list number 10 with House Bill 694. Aaron.
This bill requires the HSCRC, in coordination with the Department of Human Services, the State Designated Exchange, the Office of the Comptroller, and the Maryland Hospital Association to develop a process that identifies the patients who paid for hospital services who may have qualified for free care at the time of service in calendar years 2017 through 2021, that provides reimbursement to the patients identified and ensures that a patient's alternate address is used if the patient requested an alternate address for safety reasons, and determines how the Commission, the Department of Human Resources, and the Office of the Comptroller will share or disclose relevant information, including tax information, to the hospital in accordance with federal and state confidentiality laws to carry out this section. On or before January 1st, 2023 and January 1st, 2024, the HSCRC must report to Senate Finance and HGO on the development and implementation by hospitals of the process that is required under the bill. If the process that is established requires statutory changes, HSCRC would include the recommendations for statutory changes in the report that's required for the legislature before January 1st, 2023. But if the process does not require statutory changes, each hospital must implement the process on or before January 1st, 2023. This was in the insurance subcommittee.
Delegate Cullison. Delegate Cullison?
Yes, thank you, Madam Chair. Thank you very much, Aaron, for that summary and also for your work on this. It came to our attention in 2020 that there were instances where the hospitals had not done their full due diligence in determining eligibility for free care. And as a result, a number of patients who were eligible ended up being billed for services and paying at least part of those services. The hospitals have admitted that this has happened, and over the last couple of years, and we have put statutes in place that help them to rectify that, so that they are have the processes that help them to identify folks who are eligible for free or reduced care right away. But in the meantime, so this bill is to help those who may have been charged and it will reimburse them if it's determined that they were eligible for that reimbursement. The hospitals worked very well with us to make sure that this happened, and the bill is, as it is now amended, allows them to and charges them with coming up with a process that they will be able to accomplish the goal. With that, I move the amendments.
Is there a second?
Second.
Is there discussion on the amendments? I don't see any hands up. All those in favor say aye. All those opposed, no. Please raise your hand in the panel. I see no, oh, I don't have a panel. That's why I don't see hands. I see no hands in the panel still. So this amendments packet passes unanimously.
Move the bill as amended, please.
Second.
Discussion on the bill as amended. Any questions? Delegate Shalega.
So who's paying for it?
The hospitals will be paying for it.
And what's the budget look like?
We really don't know. The best estimate is that like 5% of the people that they reach out to will actually be eligible. The average, they expect the average reimbursement to be somewhere between $25 and $75 for these folks. So, I can't estimate because I don't know how many people, but the hospitals are set to absorb it.
And what's the, does it have an end date, or are we going to do this forever?
2021. They're being increasingly rigorous around the identification of folks. So we're anticipating that this isn't going to be happening. So, but this bill only relates up to 2021.
So this will happen for a year or two and that'll be the end of it.
That's what we anticipate.
Okay, thank you.
Any other questions? Delegate Cullison, when you say 2021, that means that what we're doing is looking backwards
Yes.
at a 4-year period. I think it's 2017 to 21. This is in
Yes.
no way going forward.
No.
Okay, thank you.
Thank you for the clarification, Madam Chair.
I see no other hands. I take it that means no other questions. All those in favor of the bill as amended, please say aye. And all those
Aye.
opposed, please
Aye.
raise your hand in somewhere, your virtual hand. I see no virtual hands. The bill passes unanimously.
I would like to be co-sponsor.
Well, there's an amendment. I'm guessing there are some people who don't want to be a co-sponsor, but I'm guessing it's a smaller number than who do. So I'm going to try all those who do not want to be co-sponsors, please raise your hand. I see Delegate Chisholm, Delegate Shalega, Delegate Saab, Delegate Kipke, Delegate Morgan, and Delegate Riley. Did I miss anyone? Staff, do you have that list?
I've got it.
Excellent. Okay. And thank you all. I know that this was a bill that was worked on by a lot of people, and in particular, the chair of the subcommittee worked closely with the sponsor. Much appreciated.
Thank you.
House Bill 699. That is Aaron.
There's a reprint of this bill on pages 9 through 14 of your packet. And amended, the bill would require the Office of the Chief Medical Examiner to post links on their website to grief counseling services and resources related to grief counseling. It would provide that one of the authorized uses of the opioid restitution fund is to support the Office of the Chief Medical Examiner and the Behavioral Health Administration in providing grief counseling services and resources on grief. It also establishes a work group that will be convened by the University of Maryland School of Public Health that will consider and make recommendations on the potential uses of the opioid restitution fund that would improve the reach and quality of traumatic bereavement care and post-intervention efforts. And this work group will report back to the General Assembly by November 1st, 2022.
Delegate Penny Melnick.
Thank you, Chairman, and thank you, Aaron. So the subcommittee looked at this bill. The vote was unanimous. On basically, the primary sponsor worked really hard to bring everyone to the table, but most importantly, not to put the burden on the Office of the Chief Medical Examiner. We know they have a lot going on, and she was able to get the University of Maryland School of Public Health to do the coordination. And the Office of Chief Medical Examiner are now just part of the work group, a member. So I move the amendments.
Is there a second?
Second.
Is there a discussion on the amendments? All those in favor say aye. All those opposed, no. Please raise your hand. I see no hands. The amendments passed unanimously. Want to move the bill?
Yes, I move the bill as amended.
Second.
Thank you.
All those in, is there discussion? All those in favor say aye. All those opposed, no. Please raise your hand. I see no hands. That bill passes unanimously.
Sponsor amendment, Madam Chair.
Pardon?
Would it be possible to do a sponsor amendment?
It would be. There's an amendment on this bill. Yes. All those who would like to be amended as sponsors of this bill, would you please raise your hands? Anyone who wants to be listed as a co-sponsor. I see Delegate Bagnall and Delegate Kerr, Delegate Lewis Young and Delegate Johnson, Delegate Belcastro and Delegate Hill, Delegate Penumelnik, with a real, oh, there's a virtual hand. It's just hard to see. And Delegate Kelly. Okay. Okay, that's the co-sponsors we will add.
You did not list me, Madam Chair.
Pardon?
My hand was up as well.
I don't, was that Delegate Kaiser?
Yes.
Okay, if I missed you, certainly we want to add your hand. And Delegate Landis wants to be added as a co-sponsor. Okay, so that was House Bill 699. We'll now turn to House Bill 723. Lindsay.
This bill renames the Purchasing Bureau in the Department of General Services to be the Office of State Procurement, led by the Chief Procurement Officer, renames the Pricing and Selection Committee for Blind Industries and Services of Maryland and the Employment Works Program to be the Pricing and Selection Committee for Preferred Providers. The bill authorizes DGS in consultation with the Department of Budget and Management and with the approval of the Board of Public Works to establish fees for training, strategic sourcing, and administrative costs related to the use of eMaryland Marketplace. Those and other fees are deposited into a fund which is renamed to be the Operations Revenue Fund and expands its authorized use to include all operating expenses of the Office of State Procurement. Under current law, auction bids are allowed only for procurements with a value of at least $1 million. The bill repeals that threshold, thereby allowing auction bids to be used for contracts of any value. The bill repeals the requirement that a procurement officer posts the amount of each bid at the time it is received. The bill requires the Pricing and Selection Committee to review and verify the prevailing average market prices proposed by MCE, and the bill makes technical, procedural, and conforming changes to state procurement law. There are amendments that begin on page 15 in your packet that remove language from the bill relating to procurement authority for DO-IT. This is to bring the bill in line with the change made in the cybersecurity bill that you all voted yesterday, House Bill 1205, that made DO-IT a primary procurement unit.
Delegate Rosenberg.
Thank you, Madam Chair. As described by council, this bill would treat three preferred providers the same: Maryland Correctional Enterprises, which used to be State Use Industries, Blind Industries and Services of Maryland, and Employment Works Program. They would all be treated the same, and the provisions of law would be conformed to prior changes in procurement for these preferred providers. It was a unanimous vote on the amendments and on the amended bill in committee. I would move the amendments.
Second.
Any discussion on the amendments? All those in favor say aye. All those opposed, no. Raise your hand. Seeing no hands, the amendment passes unanimously. Delegate Rosenberg,
I move the bill as amended.
is there a
Second.
second? Thank you. All those in favor say aye. All those
Aye.
opposed, no. Please raise your hand. The bill passes unanimously. Isn't this a nice voting session? House Bill 1020. Delegate or Aaron.
The bill requires the Developmental Disabilities Administration in consultation with stakeholders to establish and provide training materials to coordinators of community services on self-directed services. As part of developing a person-centered plan of service, ACCS must educate the recipient on the availability of all models of services available, including self-directed services. By January 1st, 2023, DDA must submit to CMS an amendment to the Community Pathways Waiver that includes overnight supports requirements. By January 1st, 2023, and annually until January 1st, 2026, DDA must report to the General Assembly on the progress in implementing the requirements of the bill and the recommendations outlined in a specified study of the Self-Directed Advocacy Network of Maryland. There are amendments in your packet that range from pages 33 to 52. The amendments on pages 33 to 39 require that the services provided are within the individual's authorized budget. And there are a lot of definitional clarifications within those amendments. The amendment on pages 38 and 39, those are actually the same amendment, and they reduce the required amount of support broker services each month from 40 to 30. And there's amendments on page 52 that are study language that would require the department to assess the fiscal impact of complying with the provisions of the bill and report back to the General Assembly.
Aaron, sorry, Delegate Penny-Melnick.
So this bill was a bill that came from a work group that the chairman put together in the interim without legislation, where Delegate, I think it was Delegate Lewis Young, and I don't know if that was Heather Bagnall was there, and others that participated. It was like 22 people. At times there were 50 people that attended the group. And Aaron, actually, thank you, Aaron, was the person that staffed it. And the group met for 7 months, and they came up with these recommendations. The department actually worked with the primary sponsor. I also spoke to the department, Heather Scheck, regarding their concern with the fiscal note. And in order to alleviate that concern, the hours were lowered from 40 to 30, the support hours. In addition, I put some language, that reporting language, so that we can really see what the expense is and how it impacts the department as well. So the Department of Health participated in the conversations. They were fine with the amendment as we put it in there. They're still, I think they're just, staying neutral, but they did participate with the drafting of the amendment. The primary sponsor did a lot of work, so I moved the amendments.
Second. Is there any discussion on the amendments? All those in favor say aye. All those opposed, please raise your hand. Seeing no hands, the amendment passes unanimously. Delegate Penny-Melnick,
I moved the bill as amended.
Second.
any discussion on the bill as amended? I would like to take a minute just to say, good job, well done. Both Delegate Karen Lewis Young, who I know worked really hard and cared passionately, and also Delegate Bagnall, who I know helped her greatly. So thank you. And anyone else who participated, but this is a good thing. All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously.
Co-sponsor?
Sure, there's an amendment. Who does not want to co-sponsor this bill? Anyone? All members of HGO who are present today will be listed as co-sponsors of this bill. House Bill 1078. Aaron. Let's all listen carefully for her pronunciation.
No, she's gonna have the Spanish person in the committee say it.
THC, we're saying THC, tetrahydrocannabinol. So this was sent in a separate amendment a few minutes after you got your amendment packet. The bill has been amended into a study, and it would require the Medical Cannabis Commission, in consultation with the State Department of Agriculture, one representative from the Maryland Hemp Coalition and one representative from the Maryland Health Alternatives Association, to study and make recommendations on the classification and regulation of tetrahydrocannabinols other than Delta-9 THC that are artificially, synthetically, or naturally derived and manufactured products containing Delta-8 and Delta-10 THC. And the Cannabis Commission will report its findings and recommendations to Senate Finance, Senate Judicial Proceedings, House Judiciary Committee, and HGO on or before January 1st, 2023. The bill also ties in the criminal law article, and it adds a new section to the criminal law article, which would provide that a person who distributes products containing Delta-8 or Delta-9 THC, including a person licensed under Title 16, 16.5, 16.7, and 17 of the business regulation article, may not purchase for or sell a product containing Delta-8 or Delta-10 THC to an individual under the age of 21 years. If in a prosecution for a violation, it's a defense that the defendant examined the purchaser's or recipient's driver's license that positively identified the purchaser or recipient as 21 years of age. It also provides that any website owned, managed, or operated by a person who distributes or sells a product containing Delta-8 or Delta-10 THC shall employ a neutral age screening mechanism that verifies the user is at least 21 years of age, including by using an age gate, age screen, or age verification mechanism. The penalties for violation are that they would be guilty of a misdemeanor, and on conviction, subject to a fine not exceeding $300 for a first violation, $1,000 for a second violation occurring within 2 years after the first violation, and $3,000 for each subsequent violation occurring within 2 years after the preceding violation.
Delegate Penny-Melnick.
Thank you, Chairman, and thank you, Aaron, and the committee for a good discussion. This is really because of there's a federal law that allows for these to be sold, and it doesn't have an age restriction. We know that these products, Delta 8, THC, and I'm not going to pronounce it with my Spanish accent, they can cause paranoia and anxiety. And Delta 8 as well. And kids are buying these, and there are a lot of them have gotten pretty sick and have ended up in the hospital. I know that we heard from Delegate Belcastro regarding some people in her community, some children in her community just recently this week, and Delegate Johnson as well. And they discussed the need for us to have some type of age limitation. That's why we allow for the study. We slowed it down a bit. It was going to be a bill. However, we heard from the industry and we decided, they were very spirited, that we were instead slow down and do a study and be inclusive. Our subcommittee added members from the industry, one of them brought by Delegate Shalega, which I appreciate that. And we added another member as well. So the bill you have in you was a compromise. And I think that if we can study it, we'll be able to come up with some good public policy next year. So the vote in committee was actually unanimous, and I will move the amendments. There's also an amendment that was brought up, which I want to thank publicly Delegate Morgan, regarding the bill right now is drafted as an emergency bill. And it shouldn't be an emergency bill because we need time for the businesses to implement it and become aware of it. So we're pushing the implementation date to July. So thank you, Delegate Morgan.
Is that amendment, Aaron, part of what you have in front of you, or is that a separate amendment that we need to adopt separately? Because
You would need to adopt that separately.
Okay, we'll address that after we do these amendments, and first we'll do discussion before we do the amendments. So it's been moved and seconded, I believe. Was there a second?
Second.
Thank you, just to make sure. I'm going to call on Delegate Johnson first because his hand was up and then it went down and then it came up, and then Delegate Belcastro.
Thank you, Madam Chairman. Aaron, if I missed it, forgive me, but what regulatory body will this fall under, this amendment about the age?
That was actually unknown, so there'll have to be some training in terms of enforcement. But I think it would be similar to how you would enforce sales of tobacco products to minors.
All right, thank you. Thank you, Madam Chairman.
Thank you.
Thank you. It's a good question. Would we expect to see that in regulation at some point, Aaron?
I think it would just, law enforcement would have to know that this is a new law and enforce it as you do the other sales of tobacco to minors.
Okay, thank you. Delegate Belcastro.
Thank you very much, Madam Chair. And I just wanted to take this opportunity to thank the Vice Chairman for being such a great listener. I think if we wouldn't have acted on this year, we would have seen a lot more of our young people and students utilizing this Delta 8 and Delta 10 in our schools. So thank you so much, Madam Vice Chair.
Thank you for bringing it up.
Is there any further discussion on the amendments before us? Delegate Kipke.
Just a quick question. I just thought of it, and I'm not on that subcommittee. There's an issue with enforcement of like the Fruity Pebbles vape stuff that's marketed to kids. It's federally prohibited, but the feds don't really do any enforcement. In the state of Maryland, it used to be in the comptroller's office, but now it's a standalone unit of government. I forgot the name of it, but it's the Tobacco Enforcement Unit. are they who would enforce this, or is it the whatever we call the Cannabis Commission?
It will be, I would
Be the
think, the
county.
law enforcement. It will be just like we do, whoever enforces tobacco, right? The sale of cigarettes, it will be that agency.
And under this, is there language that authorizes them to do it? Because the reason I'm bringing it up is that agency that does the enforcement of tobacco is not doing the enforcement of the vaping stuff that's marketed towards children, because they don't have statutory authority to do it. And maybe it's something we can just look at over the weekend or next week, but I just bring it up because it's an issue.
It's a good question, and we'll ask the AG.
Thank you.
Thank you so much for bringing it up. I appreciate it.
Thank you. I was thinking about alcohol while you were talking about that, and the counties, I believe, send out inspectors. The liquor boards do that. So this might be the marijuana council that may have people, or they may deal with the counties. It's an interesting question. We may need an answer, and it may require more legislation, or I don't know. But let's keep moving with this, and we'll see what we need. Thank you all for thinking about this. Is there any further discussion on the amendments, which is, I believe, where we are? All those in favor say aye. All those opposed, no. Please raise your hands. The amendment passes unanimously.
I move the bill as amended.
I'd like to call on Delegate Morgan first to
Okay.
offer his amendment,
Aye,
please.
that's true.
His
Sorry.
friendly amendment.
Thank you, Madam Chair. I'd like to make an amendment to move this bill to begin on July 1st.
And that
Instead
would
of
remove the
emergency.
emergency status as well.
Yes, ma'am.
Is there a second?
Second.
Is there any discussion? All those in favor say aye. All those opposed, no. The ayes seem to have it. It's unanimous. Now, Madam Vice Chair.
I move the bill, Chairman,
Second.
as amended.
All those in favor say, is there a discussion? All those in favor say aye. All those opposed, no. Raise your hand. Seeing no hands, the bill passes unanimously. It has a big amendment. Do we want to get involved in co-sponsoring this bill?
I would like to co-sponsor. Oh, actually, it's my bill, but yes.
You like it a lot.
I'll try to put it on twice,
Okay,
but it
I'm
never
so
flies.
sorry.
Anyone who does not want to be a co-sponsor of this bill, please raise your hand. If you do not want to be a co-sponsor. Okay, I see Delegate Riley, Delegate Chisholm, Delegate Landis, Delegate Morgan, Delegate Shalega, Delegate Belcastro, and Delegate Saab. Have I missed anyone? Okay, that's quite an interesting assortment of people. You will not be listed as co-sponsors, and the rest of the committee will. House Bill 1188. Aaron.
There is a reprint of this bill on pages 41 through 45 of your packet. The bill pulls in current law regarding the statewide steering committee on services for adults with sickle cell disease, and it renames that committee the statewide steering committee on sickle cell disease. If you move on to page 43, handwritten 43, the original bill is maintained in that it requires MDH in consultation with the steering committee to establish and implement a system of providing information on the sickle cell trait or the thalassemia trait to an individual who has the trait, including as determined through a newborn screen, and if the individual is a minor, to the individual's family. The department must include the following information. They must include how the sickle cell trait or the thalassemia trait impacts the health of an individual with the trait, and how the sickle cell trait or thalassemia trait is passed from a parent to a child. The bill also requires MDH to maintain in a conspicuous location on its website a list of resources for healthcare practitioners to use to improve their understanding and clinical treatment of individuals with sickle cell disease or the sickle cell trait. Strike the requirements in the original bill that would have required the Board of Nursing and Board of Physicians to include certain information about sickle cell disease in their renewal notices to licensees. The bill requires the statewide committee on sickle cell disease in coordination with the Department of Health and other stakeholders to study and make recommendations on how to enhance access to services for individuals with a focus on areas of the state where there is a statistically high number of individuals with sickle cell disease, whether to establish a sickle cell disease registry, how to enhance the coordination of healthcare services for individuals with sickle cell disease who are transitioning from pediatric to adult healthcare in the state, and how to engage with community-based healthcares and other community-sponsored events in the areas with statistically high number of individuals with sickle cell disease. And they would report their findings and recommendations to the General Assembly by December 1st, 2022.
Delegate Penny Melnick.
Thank you. I want to say thank you, Erin, because that was a lot of work. And I want to thank Pam Casemeyer, who really was instrumental in trying to help us bring all these bills. We have had so many bills this session and over the years on this topic, and we really needed to do this. So I appreciate the work. What you have in front of you, it's a package. They will look at the issue and look at it in a comprehensive manner so that the steering committee can look at it and give us recommendations. What is the best way to go about it, rather than we're all putting bills to address this issue. So I move the amendment.
Second.
Is there any discussion on the amendment? All those in favor say aye. All those opposed, no. It's unanimous. Delegate Penny Melnick.
I move the bill as amended.
Second.
Any discussion on this bill? All those in favor say aye. All those
Aye.
opposed, please raise your hand. The vote is unanimous. Is there anyone who doesn't want to be a co-sponsor of this bill? Please raise your hand. This bill will be co-sponsored by everyone present on this committee. Good work to everybody. House Bill 1370. Erin.
There are amendments on this bill on pages 46 through 48 of your packet. And they're actually, it's drawn to the Senate bill because that is how the cross file is passed the Senate. The bill would require that beginning in fiscal 2024, the difference between the amount that was collected under the fees to the fund under the transportation article and $500,000 must be distributed annually from the organ tissue donation awareness fund to the nonprofit entity that's selected by the Secretary of Health to establish, maintain, and operate the donor registry.
Delegate Penny Melnick.
Thank you so much, Erin, and the subcommittee on public health. I know you guys have been working really hard, and the chairman and I thank you for that. This bill was discussed in subcommittee. It was actually unanimous. The money has been flat funded since 2009. This money, they basically use it for marketing, for the MVA announcement, projects in the community, building awareness of organ donation. They also are the ones that maintain the organ donation registry as well. They did send us the budget that was requested by the subcommittee, and the salary of the only employee they have is, as someone said, prudent. It seems reasonable, and I move the amendments.
Second.
Is there discussion on the amendments? All those in favor say aye. All those
Aye.
opposed, no. Please raise your hands. Seeing no hands, the amendment passes unanimously. Delegate Penny Melnick.
I would like to move the bill as amended, Chairman.
Second.
Any discussion on the bill as amended? All those in favor say aye. All those opposed, no. Please raise your hands. The bill passes unanimously. I see there is an amendment. I'm going to guess that everybody would like to be a co-sponsor on this bill. If I'm wrong, please raise your hand if you don't want to be a co-sponsor of this bill. Looks like everyone's on this bill. Okay. House Bill 1381. Aaron.
There is a reprint of the bill in your packet. The bill would provide for a definition of oriented strand board to mean, it means multi-layered board that is made from strands of wood together with a binder by the application of heat and pressure with the strands in the external layer primarily oriented along the strength axis of the panel in accordance with the U.S. Department of Commerce Voluntary Product Standards Performance Standard for wood structural panels, and is intended to be used as a covering material for roofs, subfloors, and walls when fastened to the supports. The amendments provide that the section does not apply to the manufacture, sale, use, or distribution of products or materials that contain oriented strand board for purposes outside of firefighting training purposes. The bill provides that a person may not set on fire or burn oriented strand board for firefighting training purposes. And it also provides for a penalty for noncompliance with the bill for a first violation, a civil penalty not exceeding $500, and for a second or subsequent violation, a civil penalty not exceeding $1,000.
Delegate Peña-Melnick.
Thank you. And I want to thank the committee for a good discussion. The sponsor of the bill, Delegate Young, worked with the firefighters and the chemical manufacturers and the wood industry to draft these amendments. We heard from the representative of these industries that they are now on board with this language. This language is similar to Virginia, which passed the bill. We heard from the professional firefighters of Maryland that basically OSB, it's pretty bad when it's burned, and that it harms our firefighters. The bill is really narrowly focused because it says that you can use OSB for whatever you want, except don't burn it for fire training because it affects the health. So you could use it for whatever you want, except for burning it when you're doing training for the firefighters. I move the amendments.
Second. Is there any discussion of the amendments to House Bill 1381? Delegate Hill.
Thank you. I'm on the subcommittee and got the answer to my question earlier, which was about, a lot of firehouses used to do a lot of controlled burns of abandoned buildings and told that they don't do that anymore. So that raised the other question I just wanted the vice chair to be prepared for, not for me. So why do we need a bill if it's firefighters who decide what the training is? Why are they just not doing this or being told, what is the issue that there needs to be a bill when it's no one's setting up training except for other firefighters, and they know what the damage and the danger is?
The people who do the firefighter training are both public and private in some counties. So he said that there was a mixed bags, and the career departments is mainly the county, but there are also individual fire companies that do the training. The attraction to OSB is that it's less expensive than regular wood or plywood, and there's an incentive to want to use it because it costs saving, but the health effects are really bad. The question that came up also was that, do they still do control burn firefighting exercises in homes? Because most houses have OSB. And he said that having OSB in a fire structure has become less common because of its environmental and health effect. Where you would find OSB in a house is in the outer walls, on the roof, and in the subflooring. And if they were training in a quiet structure, they wouldn't be burning the outer walls, the roof, or the subflooring because it's a hazard. And this rule wouldn't still prohibit training inside in a quiet structure. So they would train, but they won't burn. And that is really how the bill just basically restricts burn trainings.
Okay, so the family house on in Hurlock, Maryland, outside of Cambridge, which has been abandoned for 20 years and is falling to the ground. What you're saying is the volunteer fire company there would no longer say, we'll accept that and we'll set it on fire so we can practice.
That's
They
right.
would-
He said that they could do other things like, cutting the door, anything else but burning.
Does that answer your questions, Delegate Hill? I know it's practice, but I'm just asking.
I think it does, and that's the answer they gave. Yeah, so I guess that's the answer we gave. But
Okay, are there any other, Delegate Shalega?
Yeah, I kind of going along with what Delegate Hill said. I don't think this bill is necessary, but they want it, so we'll give it to them. There's a limited number. The firefighters do their own training. So, I think it's just a feel-good measure, but if they want to feel good, we'll pass a bill for them.
Thank you, Delegate Shalega. Did we move the bill? I mean, the amendment,
I move the amendments.
and seconded it?
Yes.
Okay, I thought I might have just not been thinking about formal things at that moment. All those in favor of the amendment, please say aye. All those.
Aye.
Aye.
Please raise your hand. Looks like it's unanimous for the amendment. Delegate Penny Melnick,
I move the bill as amended, Chairman.
your second. Discussion. All those in favor say aye. All those opposed, no. Please raise your hand. Seeing no hands, the bill passes unanimously. We'll now move on to House Bill 13.
Madam Chair?
Yes,
Could I be a co-sponsor?
sure. Who would like to be a co-sponsor of this bill? That will be Delegate Kaiser, Delegate Bagnall, Delegate El Castro, Delegate Kerr, Delegate Pena Melnick, Delegate Cullison, Delegate Lewis, Delegate Johnson, Delegate Bandari, Delegate Hill, Delegate Landis, Delegate Young. Did I miss anyone? Excellent. Okay, I'm assuming that that's all recorded. House Bill 1389.
This bill
Lisa.
requires the Secretary of Health to establish a Prevent Workplace Violence in Healthcare Settings Public Awareness Campaign Work Group to develop a public awareness campaign on preventing workplace violence in healthcare settings, recognize and accommodate the needs of patients with mental health disorders and substance abuse disorders in the development of the campaign, and create a plan for implementing the public awareness campaign, including distributing information on workplace violence in a healthcare setting in the state. There are amendments on page 49. They alter the membership of the work group by striking the member that works in a facility that provides services to individuals with disabilities and adds a representative of the Maryland States Attorneys Association. And the amendment also strikes language that would have required the work group to recognize and accommodate the needs of patients with disabilities when developing the campaign.
Delegate Pena Melnick, you've been very busy today in your subcommittee.
Well, yeah, the subcommittee couldn't do it without them and Aaron and Lisa. We had a good discussion on this bill. So remind me, what was the vote, Aaron? It was not unanimous.
No, I think 2 were against.
And it wasn't Aaron, it was Lisa. Lisa, I'm sorry. It's my mind
That's
is
okay.
trained to Aaron.
That's okay.
Okay, so it was not unanimous. And the reason is because some of our members felt that it wasn't necessary to have the state do this. Why couldn't they do it on their own? So basically, the reason why we took it to a vote is because we did hear testimony that, the healthcare workers are being targeted and there's a lot of violence in the workplace. And they actually afterwards, one of my interns who's a doctor sent me an email, and she said that the American College of Physicians recognized this as a major issue in the US and has a position paper on it. In addition, I also found out that some of the surveys that the hospitals do in Maryland about some of the reports that they have reported on hospital assault, especially in the ER. These are not just committed by people that have psychiatric problems at all. And I think that it's just a policy decision, whether we do it or not. I feel in the majority of the committee as well, that it is important to give our healthcare workers who have had an unprecedented, just stressful 2.5 years, to give them some support. And for this to come from the Department of Health, it gives it validity and it amplifies the voice that this is not acceptable. Sort of very analogous when we do campaign on certain issues in the community that we want the community to be aware of. And some of the data that I was looking at is that 47% of the emergency physicians, they have been physically assaulted at work. 97% of assaults are committed by patients. 28% involve patients' family members. 83% of the emergency physicians say that a patient has threatened them. The nurses as well are feeling overwhelmed, and they testified today through Robin Elliott how this is a really important issue for them, and that they feel that it is important that we, the legislature and the department, try to send a message and educate people on workplace violence and to prevent it. So that is the discussion, and I move the amendments.
Second. I see some discussion here. I'm going to start with Delegate Riley and then Delegate Shaleka.
Thank you, Madam Chair. And I want to thank the Vice Chair. As stated in the subcommittee, I was basically voting no earlier this morning because I still had some questions and had, made the comment that I may, change my mind. So I do want to let you know I will be voting for this bill. I did have some other questions, and I was able to catch up with, I believe it was Dana Kaufman between committee and session. And she answered some of those questions that I still had unanswered. So I will be voting for the bill. Thank you for your patience.
Oh, thank you. I appreciate that. I appreciate your questions and your comments.
Delegate Shaleka.
Yeah, I as well had said that I was voting no because I needed more answers to some questions, and I got them as well. So I'll be voting for the bill.
That's great. Thank you very much.
Thank you.
With that, if there's no more discussion, all those in favor of the amendment, please say aye. All those opposed, please raise your hand. The amendment passes unanimously. Delegate Penny-Melnick.
Yes, I move the bill as amended.
Is there a second?
Second.
Any discussion on the bill as amended? All those in favor say aye. All those opposed, no. Please raise your hand. The bill passes unanimously. There is an amendment, so anyone who would not like to be a co-sponsor, I think that's the safe direction to go. Please raise your hand. If I'm wrong, I'll see by the number of hands that are up. If anybody doesn't want to be a co-sponsor, I see some number, but it's a smaller number than the people who do. So we'll go with those who are not co-sponsoring this bill are Delegate Shaleka, Delegate Morgan, Delegate Riley, Delegate Kipke, Delegate Chisholm, and right. My hand's not up. I am sponsoring the bill because I would like to. Okay. The rest of the committee will be sponsoring this bill.
Did Delegate Saab have his hand up or no?
I don't know. Delegate Saab, did you want to be a sponsor or no?
Yes, Madam Chair.
You do. Okay, so Delegate Saab will be listed as a sponsor along with most of the committee. Thank you. I think we have one last bill, House Bill 1471. Aaron?
This is an emergency bill that authorizes the Garrett County Commissioners and the Board of Governors of the Garrett County Memorial Hospital to lease the Garrett County Memorial Hospital or any portion thereof and transfer assets incidental to the lease in accordance with the terms determined by the County Commissioners and the Board of Governors. The bill also decreases from 9 to 3 the total number of members of the Garrett County Memorial Hospital Board if the County Commissioners and the Board of Governors lease the Garrett County Memorial Hospital or any portion thereof. There were amendments added to the bill that reduced the current number of the Board of Governors from 15 to 9. And this bill was in the Public Health Subcommittee.
Delegate Penny Melnick.
Thank you, Chairman, and thank you, Aaron. When we had the hearing, I had requested of the delegate to sponsor a letter from the delegation in the Senate and from Garrett County Commissioners. We did receive that. It's in our file, how they really want this. And they said the board and the county have been engaged in a process of long-term strategic planning to ensure the continued financial and operational stability of the hospital, and have determined that it is in the best interest of the county, its resident and the residents of the surrounding area, to enter into a transaction in the lease. So this bill would allow them to do. It is a local bill, and I actually move the bill. I don't believe it's amended. Is it amended?
Yes, there are amendments.
All right, so I move the amendments.
Second.
Is there discussion on the amendments? I see no hands. All those in favor, please say aye. All those opposed, no. Please raise your hand. The amendment passes unanimously. Delegate Penny Melnick.
Oh, I move the bill as amended.
Second.
Any discussion on the bill as amended? All those in favor say aye. All those opposed, raise your hand, please. I see no hands in the panel. The bill passes unanimously. With that, I think we finished the work before us. We will not be meeting in any subcommittee or voting session of any sort today. I cannot predict what tomorrow will bring. I thank you all for your hard work, especially the staff, but also all the members of all the subcommittees. And I thank you for your patience with the mistakes that get made, with the fact that things are moving very quickly, so you're not getting a lot of notice about things. And most of all, for just all being so very nice to work with, even in the hardest week of session. I think yesterday was the hardest day. I'm hopeful, and we all survived. And I'm sorry for ruining your St. Patrick's Day parties, whatever they might have intended to be. And I will see you on the floor at 5 o'clock, I believe, correct? Do we all have the same time? Other than the
Yes.
fact that my clock is an hour slow. Okay, thank you very much. I do